Hi, I'm Dr. Sahira Long, a pediatrician and lactation consultant in the Children's National Goldberg Center for Community Pediatric Health. I see patients for general pediatrics in the Anacostia Health Center. Thank you for joining us for today's episode of Dr. Bear Bites, where we'll be talking about breastfeeding and COVID-19. So the first question is, can I still breastfeed my baby if I've had COVID-19? And the answer to that question is absolutely. If you are well enough to take care of yourself, the most important thing to do if you have active COVID-19 is to practice techniques that you're doing to keep from spreading the infection to other people. So regular hand washing, as we've been doing throughout the pandemic. And when you are feeding your baby, you should wear a mask, especially if you have a lot of secretions. Even if you're not symptomatic, you just tested positive for COVID, you should still practice good hand washing and mask wearing while you're taking care of the baby. The next question is, will the antibodies in my breast milk protect my baby from COVID-19? And this is a question that we're actually actively looking into at Children's National and other places across the country. We do know that after a woman has been infected with COVID-19, that she does make antibodies that are making it into the breast milk. And so researchers, including myself, are looking into whether or not those antibodies that are in the breast milk are actively helping to fight against COVID-19. And if so, which they do in other infections, we anticipate that we'll be able to have the science to prove that, yes, the antibodies in breast milk are going to actually protect your baby from COVID-19. And the next question is it safe to get a COVID-19 vaccine while breastfeeding? And this question, I think we can safely say the answer is yes. In the beginning of the vaccine efforts, there weren't any pregnant or breastfeeding women included in the vaccine trials around the COVID-19 vaccine. They actually are doing trials that include pregnant and breastfeeding women at this point, and there's been no evidence to suggest that it is unsafe to get the COVID vaccine while breastfeeding. So based on what we currently know, and there's a lot we don't know, but based on what we currently know, it is safe to both continue breastfeeding and also to get vaccinated against COVID-19. And that is it for our questions. Thank you so much for listening and watching this episode of Dr. Bear Bites. If you have any questions, please feel free to leave them in the chat, or you can reach out to my team on 202-476-6941.